Hello, everyone in Mexico City. My name is Chaim Lotan from Israel, and it's a pleasure and honor to be here with you today. Unfortunately, I cannot be with you in Mexico City, but hopefully we'll be able to be with you next year or see you here with our next ICI meeting. This is my financial interest. Nothing to declare at this meeting, but I'll try to take you very quickly to our changing world that has changed tremendously through the generation. And if you look 50 years ago, this is how a normal living room used to be. But today, everything is different, and everyone in the family is busy with his digital toy. And even babies are born today with the next technology, all the way from the womb, and Generation Z is connected all the way from birth. To this, we add the changes that the COVID has brought to us in the last few years to understand what is there for us to see. Heart disease is one of the most important problems, especially in the Western world. Heart disease is the #1 killer in the United States. Almost every half a minute, we have a major event in the United States, and 1 of 3 deaths is due to heart disease or stroke. 17 million people die out of heart disease, and in China, every day, 7,000 people die of heart disease. And of course, part of it is the upcoming pandemic of overweight and diabetes. If we look at the needs are becoming larger and larger. We have the pandemic of valvular heart disease. We started with TAVI. Today we have mitral valve, tricuspid. We have the problem of sudden cardiac death, hypertension, about 40% of the population, heart failure, which is a growing problem, and similarly diabetes. Telemedicine is getting bigger and bigger, especially with all the changes that we see after the corona. The population is aging, and the people want to live better and longer. And this is one of the themes of the ICI Innovation and Cardiovascular Intervention meeting in Tel Aviv, which is trying to bring things all the way from idea to reality. Why did we choose Israel? Because Israel is a startup nation, and as we can see, a lot of startups in cardiology started in Israel with innovation in valvular heart disease, structural disease, coronary disease, etc. I'm going to cover several topics which are important and were covered in the last year of ICI: the cath lab of the future, robotics, imaging, artificial intelligence, changes in structural heart disease, new devices for peripheral vascular disease and neuro, heart failure, a growing problem, digital technologies, and regenerative medicine. Corpath, which is a company that started in Israel for robotic cath lab, has been acquired by Siemens. And today, in the future of the cath lab, we're looking to analyze both invasively and non-invasively coronary blood flow, FFR, etc., etc. Cathwork is a startup company that was trying to analyze from angiography the FFR and the flow. This was presented last year, and just a few weeks ago, 2 weeks ago, Medtronic decided to purchase this company for about $500 million. Another company similar is AlphaCath FFR solution, which from one view can give you very nice analysis of the stenosis and the flow in the artery. Another improvement in imaging is RealView, which gives you holographic images of three-dimensional CT. You can actually have it in your hand like a hologram, twist it, rotate it, measure, mark, slice, and clinical studies are starting now in Israel and the United States to analyze the importance of this in the cath lab. Also, new imaging modalities, augmented realities are coming to help us do better procedure, and we can see virtual reality assisted imaging, both in the chest for surgery and also at the heart. Ultrasight is an interesting startup that is cardiac ultrasound that you can do anywhere, even in the high in the sky, and you can actually take a regular ultrasound and using artificial intelligence, you can help the people that are doing it to find the exact angle and find the best planes to get a very nice thing. And in the future, that will be taken to the space shuttle. CENTIAR is trying to do the same order in electrophysiology. We know that when the electrophysiologist is doing his work, he has to see many monitors to look and understand what's the ablation, the mapping, the pacing. You have all the team, and it's quite complex. And if you can put everything in a virtual reality on the eyes, that can make the life and the clarity and the procedure much easier. So in the future, the cath lab work will definitely be done in a different way. Another place where we see a lot of advancement is structural heart disease. We do know that the aortic valve problem is almost over with several valves, core valve and sapien, and now we have few more valves. But now is the time for the mitral and the tricuspid. And here we have been able to see many technologies, the Valtech cardio band, which is done transfemoral C-shaped ring that you can bring all the way to put. We have the Valcare Amend, again, a very nice ring that you can bring transfemoral, align it in the valve, and then with the help of grippers, you can actually bring it in order to minimize the amount of mitral incompetence. Valfix is another thing that actually you can come and bring it, and you can see that the guiding catheter is coming over the wire. You bring it to the left atrium, and you see the wires, you see the thing coming on the valve, and then actually you have supraannular fixation, and you can actually try and fix the valve. Another valve, which is actually already in clinical studies, is the InnoValve mitral valve replacement, where you put the valve and you use the cord to attach the valve in the place. We have done already 6 patients with quite success. Going from the mitral to the tricuspid is TriPair, another solution where you can see that you have something like a balloon which you implant in the right atrium, and this is in the middle of the tricuspid valve, preventing valvular regurgitation. Supposed to be effective, quick, and retrievable to prevent tricuspid regurgitation. We have already ideas for treating the aortic valve in cases that you have aortic valve insufficiency, another problem that we still don't have a good solution. And CUSPA is coming with the artificial cusp that you attach it to the native cusp to prevent regurgitation. 9J Medical, another next generation replacement therapy for the tricuspid. You can see a nitinol, very thin film valve, and this is how the valve is attaching to the tricuspid previous valve for better attachment and solving the problem. Another Israeli company for tricuspid regurgitation, tricuspid displacement is Trizol, which has a cell-like pericardium leaflets. And you can see here 2 leaflets, and this is how it looks. Again, this company is starting now first-in-man study with complete replacement of the tricuspid valve. Last one that was presented is Caudio Valve. Again, a transfemoral, transseptal solution, 26 French, both for the mitral and tricuspid. The company has finished already close to 20 patients in Europe and United States, very successfully. Another idea is not replacement, but trying to fix in a way the aortic valve for patient with severe aortic stenosis, very calcified valve that are high operative for surgery risk. And this is a mechanical way to open and dilate very nicely. Instead of 1 centimeter, you can achieve 1.5, 1.6, which might be enough for several years. If we move from the structural heart, we have new devices for peripheral and neuro. Cerebral protection in the time of aortic stenosis is becoming an important problem. Keystone was the first one with the TriGuard device, but now we have several companies trying to do the same in brain protection. We have the Synaxis generation. We have the Emboliner that again is at the end of running first in man and starting a big FDA study. The Filtrex, which is a total body solution, which gives you a solution both for the brain and also protecting the kidney from emboli. And as I mentioned, the Synaxis one, all of them are at the range of doing clinical studies. Another big problem is aortic dissection, especially type A aortic dissection. So far, the only solution is surgery, big surgery, and Nexus has a device which is composed of 2 stents, one inside the other, coming from the femoral and the carotid subclavia, in order to find a way to fix type A without a major operation. They've done already 30 first-in-man cases for CE, and now they're starting a big study. Bandit is a startup company, especially for the brain, that can take very thin nitinol and from the outside navigate, and you can change the angle, the shape, the size, all the way from up the outside. And this is going to be a solution which probably in the future will be coupled with ways to do robotic intervention in the brain. Sanofi is taking us to a totally different place. We know that in patients with erectile dysfunction, 70% suffer from vascular problem. Vascular leak is the largest in the ED market, and therefore the company has developed a novel solution to enable needle-free spontaneous performance. In what they trying to do is decrease the size of the dorsal vein in order to increase the pressure and improve the erectile dysfunction. They've done already 10 patients with success, and now they're running also into a big study. As I mentioned before, heart failure is a big problem. And we have several advances in this. Donisi is a contract-free safety net for patients with heart failure. It's a monitor device that gives you a lot of parameters that can monitor the patient from remotely, blood pressure, heart rate, saturation, and a lot of other parameters. Invasively, we have the VLAB. It's a system that you implant in the left atrium, very tiny microcomputer, microprocessor that is attached in the interatrial septum. And as you can see, this is where you place it in a small invasive procedure. And immediately you can get recording of the pressure of the left atrium. And if the pressure fluid level is high, you get an immediate reading and you can tell it to the patient. Interatrial shunts can be shown to decrease the pressure in the left atrium when the pressure is increasing, both in HEPFEF and HEPFREF. V-Wave was the first one, but now we have NOYA, which in Israeli and China cooperation. And the idea is that you can have this device, which is put in the left atrium, open. You can do ablation using RF. And once you're finished the ablation of the interatrial septum, you take it out. Post-corona, we have many new companies in the digital health arena. And again, just mention a few of those. Alio is a wearable platform that improves the outcome because it gives you a smart patch with all the parameters that you would like to have on a patient: heart rate, blood pressure, saturation, respiratory rate. So the patient is monitoring anytime, anywhere. Serenus is another company, on the other hand, which is using AI to empower the medical decision. Once you have the presentation of the patient with all the medical information that you have, you get a machine learning of trying to analyze through a lot of previous cases in AI and try to understand what is the patient, what is the analysis of the results, learn the patient and plan an input. And this is an always learning system trying to improve the patient outcome. And you can see that you get all the factors from the patient, from the lab, into a medical brain, artificial intelligence, which gives you and the patient the way to continue monitoring and treatment. We do believe that today, in some cases, the patient has to be always in line. And in the future, as we see, the patient will have a lot of wearables, especially in conditions which we need monitoring, like diabetes, like congestive heart failure, like obstructive pulmonary way. And this can be achieved through several devices. For example, a ring that can monitor heart rate, blood pressure, even saturation, and everything is sent to the cloud. Or another Israeli company, Cardiac Sense, that can give you saturation, PPG for blood pressure, 1 and 3 leads ECG, and this is for arrhythmia detection. And the idea is that you don't measure it only when you want, because you may have an atrial fibrillation episode at night and no one knows. This is monitored 24 hours a day. The data is sent to the cloud, and if there is an event, it's automatically sent to the patient and to the physician. Cardiac Care, for example, is another company that combines both analysis, monitoring, and treatment. We do know that intervention with the vagus can affect and reduce episodes of sympathetic overdrive and can reduce atrial fibrillation arrhythmias. And this company is aiming to have a smartwatch that can detect ECG, PPG, sleep monitoring, oximetry, but especially atrial fibrillation burden calculation, and at the same time apply treatment, and the treatment through the vagus can actually decrease the amount of atrial fibrillation. Last but not least is regenerative medicine, which is probably one of the futuristic topics in treating heart disease and heart failure. With this, we have a session talking about cell therapy, gene therapy, stem cell therapy, tissue regeneration, and also bioprinting. And last year, we've been able to see the first printing of a whole heart. It's still a very small heart, 2-3 centimeters, but we do believe that this is a way to start thinking about printing a whole heart in a printer for patients who will need heart transplantation. So where are we going now? What's the future? If you're interested, I would be happy to invite you to our ICI meeting, ICI for All, which will be in December 4 to 6, 22 in Tel Aviv, Israel. And you'll be able to think and hear and listen to all the new developments in all major parts of heart disease. Thank you very much.